After attending a conference, we are often very excited because we've learned so much about evidence based practices, or maybe we've even networked with new colleagues that we will work on a research project together with, or maybe we have learned about a new teaching strategy that we want to try out, and we finally feel like we have enough support, enough direction in order to implement this new strategy. Whatever your focus is as we finish out this semester, if you're watching this snapshot live, we want you to focus on three key elements to help us all create more resilience in the classroom. Okay, so that's what this snapshot is going to focus on. Welcome, everybody. If this is the first time that you are joining us here at Dr. Sellars Educate, we want to start out by saying welcome. Our mission is simple here at Dr. Sellars Educate. It is to support every nurse educator to achieve success in the classroom and to successfully pass the CNE exam. We hope that you are thinking about attending the NLN conference, which is coming up in September, or maybe there's another conference that you are attending, okay? And if you are, that's great. We want you to focus on one thing when you go to your next conference, and that is identifying a teaching strategy to help you become more resilient in the classroom. That is going to be our focus for this snapshot. If you haven't already, we want you to go ahead and print out the study worksheet that's listed right here in the description. This is going to ensure that you stay focused as we hone in on a specific topic to help you achieve success in the classroom and on the CNE exam. In this snapshot, as we focus on resilience, there's actually 4 different competencies that this content is aligned with. Number 1 is facilitate learning, our ability to engage with our students in the classroom in a way that is going to be impactful and to help them achieve success, right? We don't want to be that sage on the stage. We want to be a guide on the side. Implementing resilient strategies and completing training helps us be better equipped to do that, okay? And then second, we want you to think about, as you're processing the information today, we want you to think about what are you doing right now in your classroom experiences, whether it's clinical, simulation, or it could be a virtual learning experience as well. We want you to think about how are the practices that you're using right now helping to build resilience in the classroom. Okay, so this is competency 2, looking at facilitation of learner development and socialization, and then taking a look at competency 4, which is around curriculum. So what are the key components of the curricular model that I'm using in my everyday learning experiences with my students, and how is that supporting resilience? We know that we need our nursing students to graduate, and we want them to stay in nursing, right, for a long time. We need really good clinicians at the bedside and in other areas as well, okay? And then the 4th competency is going to be looking at that continuous quality improvement, being a change agent and leader, okay? And then there are some elements that you could probably align with Boyer's scholarship model as well. So first, I want you to write on that study worksheet if you haven't already. First is going to be the date, today's date, whatever date you're watching this snapshot. And then second, what is your objective? What is it that you want to walk away with better understanding, or maybe something new that you learn about in this snapshot? Okay, so we want you to be very focused on what your objectives are as you move forward on your journey. So let's go ahead and jump into our content, looking at building resilience. What is our role as a nurse educator to ensure that we are providing the key steps in the nursing student's journey towards excellence to make sure that they cross that finish line, right? It's more than just about graduation. It's more than just about NCLEX. Those are key milestones. But ultimately, we want students to feel like they are equipped upon graduation and entering the nursing workforce to manage the stress that they will experience in their nursing career. Okay, so that's what resilience is all about. So we always like to start with our thought-provoking questions. So let's take a look if you haven't already. We want you to go ahead and write down what you think the best option is. All right, so here we go. The nurse educator is designing curricula to build resilience among nursing students. Which of the following competencies will be most beneficial in meeting this goal? All right, so we have 3 options. So A is ability to perform evidence-based clinical practices. B is understanding of educational theories and principles. And then we have C, proficiency in technological tools used for online education. All right, so go ahead and write down what you think the best option is for A, B, and C. While you're thinking about it, when you get to the CNE exam, CNE clinical, or CNE novice, remember to think about two questions. Okay, number one, what is this question really asking me? Okay, and then number two, what is it that I know for sure about content related to this question? Now, we don't know what the passing score is, and Alin will not disclose this, but this is what they tell us. Make sure that you are using the recommended resources to ensure that you're closing your knowledge gaps so that you can be successful on the CNE exam. Remember that competency 1 and 2, being a really good teacher, and socializing and integrating our learners into the learning process. It's not enough just to teach. We want to make sure that learning is happening as well. So consider looking at Kolb's experiential learning theory as described in Billings and Halstead. That's a primary resource we want you to use on your journey, and the link is right here in our description if you're not sure where to find it. And then the second resource you're going to use is Dr. Caputi's CNE review book, okay? You want to also make sure that you print out the candidate handbook and align your competencies and your knowledge of these sub-competency statements as identified in the candidate handbook to make sure that you close your knowledge gaps before you take the exam. All right, so think about what is the best option for this thought-provoking question. And we're going to now segue into the 3 key elements we want you to consider to support building resilience, okay, in alignment with the 4 to 5 competencies that we've talked about. So number 1 is to identify the key factors. Well, what do we mean by that? Well, we know that students are stressed in the nursing program, right? There are so many competing priorities that they have, such as academic pressures, clinical experiences. There may be personal challenges. We want students to have the skills and really the tools that they need to manage the challenges that they're going to have, because we know as part of a nursing program, it can be very challenging. Okay, so we're going to refer our students to available resources on campus. We are going to support a student-faculty rapport that allows students to feel like they are in a brave space when they are meeting with us to best help them work through any challenges that they may have. Okay, so NLN is not expecting us to have all of the answers for our students. It's just expected from a nurse educator competency standpoint that we are knowledgeable about the available resources that students have. If they're struggling with a specific concept that they just can't quite understand what is intended regarding patient care practices or how a disease process unfolds, such as COPD. Sometimes when they study so hard to better understand ABGs and how it relates to the treatment that they are going to give for the COPD patient, it can be a bit of a challenge. And so that's just one example. If we're able to really narrow it down to better understand what concepts students are struggling with, then we can best help them close the loop and clarify their muddy points. So it may be that a peer tutoring session would be most helpful, or maybe they want to come to a group study session. Okay, so just figuring out and helping students figure out how to best close their knowledge gaps and equip them with content in the textbooks or resources that will help them manage those academic pressures. And then the second strategy that we want to consider to help build resilience is looking at techniques such as cognitive behavioral strategies. And what do we mean by that? Well, thinking about stress management workshops, referring students to those, and even us taking advantage of those as faculty. Resilience is often role modeled and described in the classroom. That is what's going to stick with our students, okay? Because again, we want them to have a long career in nursing. So using workshops as a strategy, integrating into our curriculum elements about mindfulness as an example. I'm thinking about peer support groups that students have access to, and mentoring. We know how important mentoring is as an academician. Well, we want to make sure that we talk about that in our nursing programs, and the students do have a mentor identified when they are transitioning into practice. And then the third element is the training that we all want to take advantage of. Many universities do have resilience training, but I would even add that there's a lot of free training available online too that's pretty high quality. So I encourage you to determine what training is available for us as faculty, because again, we want to role model resilience for our students. It requires us to show up excited, to have enthusiasm about our interest in supporting the learning experience for the student to help them be successful. When we show up in the classroom, it is a collaborative experience, right? We want to be that coach. We want to be a facilitator of knowledge. We don't want the engagement to be one-sided, meaning that we don't want to be the only one that is sharing information as adult learners. Thinking about Malcolm Knowles' adult learning theory and andragogy, we want to engage the learner in those self-directed learning practices, right? We want to stimulate and motivate an interest in our adult learners so that they can go the next step in identifying where their gaps are, having that increased self-awareness, and then identifying what are the tools, what are the resources that they need to make sure that their knowledge gaps are closed. Okay, so I know this is sounding a little familiar. It's the same steps that you're taking on your journey if your goal is to achieve your CNE. So again, just to recap, the 3 strategies we're going to use is, first of all, identify key factors. So what is the trigger? What is contributing to challenges that our students may be having or that we may have? Second is consider those resilience building techniques, whether it is attending a mindfulness session, stress management workshops, spending 3 times a week, moving our bodies for at least 30 minutes. These are known as cognitive behavioral strategies. And then third, engaging in a organized training session. Okay, that's going to best prepare us as faculty to best support our students in developing resilience. All right, so let's take a look at our thought-provoking question. If you chose understanding of educational theories and principles, you are correct. And hopefully you have a good understanding as to why, but if not, I want to give you a resource. Okay, so Billings and Halstead, table 14.1, and we're still in the 6th edition. If you're on the CNE journey, that is the version that is used by the NLN exam writers. Okay, it's the 6th edition. And if you are not clear about educational theories, we mentioned 3 here. We talked about Kolb's experiential learning theory. We also talked about Malcolm Knowles' adult learning theory. And we introduced some of the elements that are aligned with Patricia Benner's novice to expert model. Okay, and so just think about how these theories really show up in your classroom. And if you're not sure about that, table 14.1 is going to be a great resource for you. All right, well, we hope that this snapshot has been helpful. Make sure that if you have questions to reach out to us, info@drsellarseducate.com. We look forward to seeing you in the next snapshot. Have a great one, everybody.